So today I'm going to be showing you how to use several different instruments, but before I get started with the instruments, I want to talk to you about clock positions. Most instruments, it's going to be the same clock positions depending on where you're at in the mouth. So on surfaces towards you, meaning surfaces that you can see, you are going to be at 9 o'clock for the most part. And then surfaces away from you, meaning you're going to have to use your mirror for indirect vision. You want to kind of angle your chair at 10 or 11 o'clock and then use your mirror to see these surfaces. And then when working on the anterior teeth, for surfaces towards you, you're going to be at about 8 or 9 o'clock working on these surfaces towards you, and you will have to angle your patient's chin up or down, whichever helps you get the best. Usually on the maxillary, you want to angle them up. You want the chin down for the mandibular. And then on the anterior surfaces away, you can sit at 12 o'clock. And then again, you'll have to adjust the patient's chin to where you can see it the best. The first instrument I want to talk to you about is the 1112 Explorer. This instrument is used to detect calculus. Whenever you're using it, you want to have a light grasp on it so that way you can feel the calculus better. If you have a death grip on the instrument, then it's going to be harder to feel. So whenever you're using this, it does have a right and wrong working end, so you'll have to flip it depending on which quad, which area you're working on. So to find the correct working end, you'll want to place it in between two premolars, or it would even work between two molars. You want to make sure that the terminal shank is parallel with the long axis of the tooth. Incorrect working end has it coming across the tooth, and that is not what you want. So whenever you're using this instrument, you want to be touching with just the tip third. So that's about 2 millimeters from the tip. That's where you're gonna be able to feel the most. And then whenever you're using this, you find your correct end. You always start at the distal line angle, and you wanna have the fulcrum on the tooth adjacent to where you're working. So you want to start at the distal line angle and then just use gentle exploratory strokes, and you do go subgingival with this to feel the calculus. And then you want to angle it in the interproximal areas. And then you move on to the next tooth. Distal line angle, distal, come out, rotate, and then come towards the mesial. You do this the same way for all the posterior teeth. And then when you get to the anterior teeth, you are only going to do surfaces away. So you can sit at 12 o'clock for this. And you just break the tooth in half, go towards the middle. In these teeth, you want to make sure you're really angling it in to where you're touching the side of the tooth. And then once you've done the anterior, you're going to flip your instrument And then you'll have to use your mirror for indirect vision. And then you'll start at the distal line angle of the most distal tooth. And then come mesial. And then when you get back to the anterior teeth, you will go to about 8 or 9 o'clock, and then you're going to do the surfaces towards you. So starting at the half, and then do the surfaces that you didn't do before. The next instrument I'm going to show you is your periodontal probe. When using this instrument, you want to use slow walking strokes. You don't want to be sliding the instrument because that will cause tissue trauma. You just want to just slowly walk it up and down along the gum line. You don't want to go in real deep. You just want to go deep enough to where it blanches the tissue. And so with this one, you're going to start at the distal line angle. Make sure you have your fulcrum. And then you're going to go distal. And then you're going to come mesial. Till you get to the interproximal area. And you're going to pull out slightly, go on to the next tooth, and then come around mesial. This is one of the few instruments that you can actually use your finger to move the instrument. Normally you would want to use your wrist, but with this one you can use your finger to kind of guide it up and down. When it comes to the anterior teeth, you're just going to keep going along, do the whole tooth. And I find it easier to tilt the patient's chin towards you and just kind of stay at 8 o'clock. And then you would continue going around. And of course, once you get to these surfaces back here, you'll need to use your mirror for indirect vision so you can see better. The next instrument I'm going to be talking about is the 204S. This is a universal scaler, so this will be used for supragingival calculus. It does have a pretty sharp tip, so you don't want to really go under the gingiva because it could cause trauma. It has cutting edges on both sides. And there is a correct and wrong working end when you're in the mouth. A trick that I have learned is that this shank makes kind of an arrow, and if you point this arrow towards the posterior of the mouth, then that is the correct working end. If that's not something that you're used to doing, you can do the premolar test like we did with the Explorer. You can place it in between two premolars, and if the terminal shank is parallel, then that is the correct working end. If it comes across the tooth, then that is incorrect. Okay, so with this one, like I said, it's universal, so it can be used anywhere in the mouth. I like to use this one on posterior teeth because it does have that bend, so it kind of makes it easier to get back there. You want to start at the distal line angle and go distal first, and then come back around, and you're just using the tip third, so like 2 millimeters of the tip to remove calculus. And then you want to go on to the next tooth. Distal line angle, go distal. And you use this instrument similar to how you would the Explorer, in that you want to do all the posterior teeth, and then once you get to the anterior, you want to, draw a line down the middle of the tooth and then insert in the middle and then come around. And just do the surfaces away first. You have to really angle it in since it does have the bend in it. And then once you've done all the anterior teeth, you flip your instrument, start at the distal of the most posterior tooth, and then come back around. And then you will do the surfaces towards from this angle. Then you'll come back and do the surfaces towards. Okay, last but not least, we have our Gracie curettes. These are used, well, these particular ones are used on posterior teeth. The 11-12, as you can see, has a little bit of a bend to it, but it's more straight than the 13-14. So these are used for subgingival calculus because they do have a toe, so it's not as sharp as what the tip would be. These only have one cutting edge, so the way you determine that is you want to look and see which side is lower. So you can see that this end kind of angles downward, so this is going to be your cutting edge. So the 13-14, since it does have more bends, it is used for distal surfaces. 11-12 used for mesial surfaces. So when using these, you want to determine your working end. And again, I like to use the trick where the arrow points to the posterior of the mouth. But again, you can just look and see which side is lower as well. And that's the side that's going to go to the tooth. So this one is for posterior teeth, or for distal surfaces only. So you want to insert at the distal line angle. Use exploratory strokes. And if you don't feel any calculus, then there's no need to apply pressure. But if you do feel calculus there, you can use a more firm lateral stroke. And then you go on to the next tooth, doing the distal surface only. And then the next tooth. And again, this is for posterior teeth only. And then once you've done your distal surfaces, you can pick up your 11-12. And this is for mesial surfaces. So you want to enter and just go mesial.